I am your host, Beth Clarity Lewis. I am the founder of Verve Counseling, the founder of Long Live Lively, and the founder of this podcast. Welcome to the Verve Counseling podcast, titled This Won't Be Done by 5, which gives a nod to the human condition, which simply holds no deadlines. I'm just going to stop there. Hello and welcome to Verve Counseling's podcast titled This Won't Be Done by 5. We are super excited. I am super excited today. This is season 3, episode 3, and we have a neighbor and partner in wellness, Dr. Alex Strong, who is the owner and founder of Fort Worth's Fort Wellness. And she is going to talk with us today about the services she offers. And let me say, Alex, may I call you Alex? Is that
absolutely
sufficient?
Yeah, for
Okay.
sure.
Let me say, and I will say your credentials, you have a PhD in nursing practice. You've got you are a nurse with a PhD, and you started out in marketing, I believe. Is that correct?
Yeah, my first degree was actually a bachelor's in advertising way back in the
Advertising. There it is. Very good.
and I worked for a medical device manufacturer and had kind of an existential crisis and then went to nursing school. Became a transplant nurse for several years. Sorry, you've got my assistant.
I love it. That puts me at ease. I love it so much.
They come to work with me every day. And then decided to get my nurse practitioner. So I went and did my
Excellent.
master's and worked in family medicine for about 9 years out in Weatherford. And about 3 years ago, moved into more of the wellness, functional medicine, preventative space.
Excellent. Excellent. Well,
Yeah.
welcome to our podcast, and thank you for being one of
Thanks.
our adored partners. Verve Counseling has a partners program, and we partner ourselves with various neighbors who we feel come from a similar mindset towards health and
Absolutely.
wellness. And Dr. Strong and Fort Wellness definitely fit that criteria. So we're going to just kind of open up the door to you, Alex, if you don't mind, kind of just giving us an overview of Fort Wellness and how long it's existed and what
Yeah.
you're excited to share with our
Yeah.
listeners.
So I I started Fort Wellness. It'll be 2 years in February. A little bit before that, I was working for another clinic in the Fort Worth area that was more kind of a concierge medicine type setup. And through that, I learned a lot about peptides and functional medicine. Although having learned about that, it really is kind of the basis of how I've practiced for so long. I just didn't really know what to call it.
Mm-hmm.
I feel like there can be definitely a beneficial relationship between Western traditional medicine, Eastern holistic, kind of getting to the root of the problem. That was always a frustration I had in Western medicine working for a large hospital system, is that I just wasn't allotted the time to get to the root cause of certain issues. So yeah, about 2 years ago, I started For Wellness with the encouragement of my dear husband and my best friend, who's also an entrepreneur. And I just was kind of at a loss. And she's like, just do it yourself. Just
Yeah.
dive in and do it yourself. And took her advice. And it's been a fun, wild ride since then. I
Excellent.
include things in my practice like IV hydration, vitamin shots, peptide therapy, weight loss management, hormone optimization. I just finished all of my postdoctorate certification courses through IFM for functional medicine certification. So I'm waiting to sit to test for that. And that should
Excellent.
be hopefully mid spring of next year. But all the courses are done. So definitely looking at each person, each patient is their own organism their own being, and there is no one size fits all. So really, when people come in, I just like to get to the root of everything, find out their priorities on what they would like. If they had a magic wand, what would we fix, and kind of start from there.
I love that. I love that. And I really like, real quick about your dogs. Don't you have 3 of them? Is
I have
is that
two.
right?
This is
2?
the
2.
baby.
I love it. Oh
This
my
is
gosh.
oh, this
That
is
makes me
Silver.
so happy.
He's six
So
months
happy.
old. He
What's his
just got
name?
a Silver.
Silver. I
Silver, and then I
love
have
it.
Rocco, and Rocco is an 11-year-old Australian, Shepherd, and he's just a happy old man.
I
He's
love
just
it.
rawhide right now, so, yeah,
Excellent.
it's
I
fun. They
love it.
come
That
to
makes
work
me
with
happy.
me. Yeah, they come to work with me when, my husband's out of town, and the patients seem to
Love
love them,
that.
so, yeah.
Well, and I right before you got on, my cat, who's right over here, was introducing. He was letting probably Jason know that he was here because
Because
I
we're
don't know.
pals.
I feel like
Yeah.
Jason is an old family friend to my pets. So anyway, pets make me very happy. You were talking back to Fort Wellness and all of your credentials and all of the studying you've done to help people really come into their own relationship with their own body and how they can heal, or how they can be healthier
Mhm,
versions of themselves, and what that looks like for each person. I love your um, eh, observation of Eastern medicine versus Western medicine. I'm a big believer in Eastern over Western. I like how you're combining the two. That makes the most sense. It really does. I'm a believer in each one of us having a relative sense of power over our health and our
mhm,
wellness, and to be able to kind of engage in a lifestyle that really helps that wellness. And what your practice does is it just kind of supports that lifestyle. It kind of
mhm,
supports, if we're kind of in a rhythm of wellness in the first place, it seems like your practice kind of scoops in and supports us to do it maybe stronger or a little better. Would that be somewhat accurate?
Oh, absolutely, absolutely. Sometimes it's just a matter of finding the path of least resistance, and that will kind of encourage a patient to start to make better choices overall. Sometimes
Hmm.
it's like when you're back in school and you're supposed to write an essay. The introduction paragraph, the first paragraph is always the hardest. So I
Hmm.
was always taught, like, start with your conclusion and then go,
Yep.
almost backwards.
Yeah.
But it's very similar to patients. Sometimes they come in and they've had so much pain and discomfort and dysregulation for so long, and making decisions along the way that don't support a healthy, regulated lifestyle, that it's just a matter of just trying to fix one thing at a time. And it's a
Hmm.
slower process, and most people wanna come in and have everything fixed all at once.
Hmm.
But it does, it takes time. I always tell my patients, especially in weight loss, it didn't take you a month to get here. It's not gonna take you a month to get to where you wanna be. It's a
Okay.
journey. No. No.
That's right. I feel like we have similar conversations with our clients. Maybe not every one of them, but a conversation about the the expectations of therapy and kind of
Mhm.
how therapy gets to unfold. And it's not a, hey, come in and see us for 2 or 3 times and we're going to send you out the door
Mhm.
fixed. One, we're not trying to fix anybody. Two,
Mhm.
we're just trying to support and kind of offer them supportive tools and lenses to use that really build them up and lift their life and their lifestyle, which is so similar to what you're doing. um you
Mhm.
know Alex, last weekend, this is Friday, last weekend, true story, I sat, before I even really dove into what it is Fort Wellness does so beautifully, I was doing a deep dive into GLP-1 stuff
Mm.
and going in
Yeah.
and just researching and reading pros and cons and reviews and articles to educate myself. I have a girlfriend here who is kind of entertaining the idea, and I'm like, I want to know this stuff. I want to research it. And I know Heather has
Yeah.
such an experience with it, and she has such a knowledge. And so I was like, I want to know what Heather knows, or I want to know what you know, like just kind of get a grip on it. And I mean,
Ah,
it was such a rabbit hole and a deep dive of information on these various GLP-1s. Tell me about, because I believe, and of course, educate me if I don't get it right. I believe that these GLP-1s started out and are still really focused on for diabetics and for
right.
sugar regulation. Talk to me
Hmm.
about how it
Yeah.
parlayed into the kind of the weight loss area.
It's actually really fun. When I started out in family medicine back in 2014, 2015, we're given in school certain algorithms to follow. And like, if this works, great. If it doesn't, then add this and then add this and then add this. And there was a rep that had come in and was telling me about, I think it was Trulicity, which was the first one of the primary GLPs that came out specifically for type 2 diabetics, but it was a once weekly shot. So, I mean, who wouldn't want to do that instead of giving yourself a shot every single day, like once weekly?
Right.
That's fantastic. Um, and so I started using it on my patients and just clinical experience. My patients felt better. They lost weight. Their A1C got better. They didn't have as much pain. I mean, it was just so many of these things that were beneficial for the patient that usually when you start a patient on medication, you're combating a lot of side effects. You're like, well, just stick it out and, hopefully things get better. But this was a class of medication that was really beneficial in a lot of
Mhm.
different ways. And I feel like if you're going to be put on a medication, like there should be more than just one benefit to it, right?
Yeah.
So, as a lot of times medications do this, a really good example is neurontin or gabapentin. It was originally a seizure medication. We don't use it for seizures anymore. We use it for pain control, nerve pain, pain from shingles. Some even use it for anxiety. There are side effects to it, like they are any medication. But as time goes on, we start seeing that these medications can be used in different populations and for different ailments and problems and at different doses. And that's kind of where this grew into is that I think a lot of practitioners, myself included, were using GLPs specifically in my patients that were like PCOS, infertility, testosterone excess, are trying to use it in a more hormonal management way because of the fact that it reverses insulin resistance. And insulin
Mm.
resistance is very, very much tied to a dysfunction in the hormonal cycle. And so I saw my patients start, they were losing like 10 pounds a month. And I'm like, that's phenomenal because a lot of these PCOS patients can't lose weight. I mean, they'll try
Mhm.
everything they can. They will eat Atkins or low carb or keto and they'll work out and they'll do CrossFit and they'll run and they gain weight. So this was
And
kind of like a
and they're not thriving. They're not
no, they
that's
feel
probably pretty
awful.
miserable doing that. Yeah. Mhm.
It's a life of deprivation and
Right.
rules and it's just nobody wants to live like that. And so usually they'll stop and they'll gain a bunch of weight because it's kind of a rebound.
Yeah.
But this class of medicine was just such a godsend to a lot of patients. And through that, I started seeing, well, it's like, yeah, we can use it for my pre diabetics, people that aren't technically diabetic, but they're like on that route, on that route. And it would bring them back to normal, it would bring them back to homeostasis and help them lose weight, help them feel better. And it's kind of when it started really blowing up. And then the reps started coming in and saying, did you know you could use it for some weight loss and like it helps
Yeah.
diabetes, but they might shed like 10 or 20 pounds. And the drug companies caught on to what the providers were saying. And so they changed direction and started marketing it towards weight loss specifically. And patients who don't have diabetes do lose a lot more weight more quickly than those with diabetes. So that's
That's
kind of a
interesting.
caveat. But it's been, I mean, I've had patients get pregnant that were told they could never get pregnant. They did
Amazing.
IVF. And they started using a GLP, and now one of them has a daughter, which is amazing.
It feels
I've had
sorry, go ahead.
no,
My
go for
bad.
it.
Well, it sounds like and to your point and all the research, I mean, I have like pages of different things I printed out because I was so intrigued. And it sounds like a wonder drug. Like it sounds like this super thing. One question I have, and I don't need if this is a naysayer thing, the thing that I read that turned me off about it
Hmm.
is that again and again, I hear that you have to stay on it because if you come off of it,
Yeah.
you're gaining all the weight back.
I think so. This is what I tell my patients because
Heather's
I hear
like,
that
"Nope,
a
not true. Go
lot. I already see her. She's like, no, that's not true. Um,
ahead."
so I usually will tell patients if someone has struggled their entire life with being overweight, obese, fluffy, whatever you want to call it, like if they were always the fat kid, they were always the bigger kid, they have a bigger family, then biologically there is something dysfunctional.
Mhm,
Then yes, this is probably going to be a chronic medication because obesity is a chronic problem for them. For
okay.
someone that maybe had 3 or 4 kids in, like, 5, 10 years, and they just weren't able to shed the weight, or maybe they had a knee replacement or they got injured, but they'd never really struggled with weight prior, then no, it doesn't have to be a forever medication, not at all. I think there are situations where, there are some people that I'm like, listen, this is probably going to be something we're going to stay on long term. And we just kind of figure that out as we go. But most of the time, one of the beautiful things about the medication is that it helps to manage the hormones in the brain that control the desire, satiation, kind of reward cycle. So
Mhm,
as you're going through the medication treatment, you're relearning what is your relationship with food, portion size, desire, reward when you eat that thing that you're like, I think I kind of really want an Oreo, and you eat it and you're like, well, that was kind of boring. It's helped tremendously with
what?
alcohol cessation.
Yeah,
And so if you can retrain your brain and relearn, and you continue those things after you stop the medicine, then the likelihood is pretty minimal. The research from Wegovy shows, and this is for obese patients, when they were on, I believe, the drug for 52 to 56 weeks, they stopped the drug. It took about 6 months for the weight to start coming on, but when it did, it was much, much, much slower. So it was like a pound
okay.
a month. So it's
Mhm,
really about maintaining all these therapeutic lifestyle changes that you created during the treatment time and carrying that through. I mean, for patients that feel like this is a magic wand, I mean, it can be for a short time, but if you don't make any changes, then it's just like any other diet
yep,
drug out there, you
right,
know?
right. That
But
makes sense.
I mean, I personally, I was about 50 pounds heavier, obsessed with food. When I stopped drinking about 6 years ago, food became, I wouldn't say an addiction, but it was kind of an obsession. And so
Yeah,
I was thinking about food all the time, all the time. I ate all day. I was snacking all day. I'd have full meals. I put on 50 pounds. I was close to 200 pounds. And being on the GLP quieted the voices. It
yeah,
quieted the obsession. It gave me the control back, and it gave me back the ability to make the right decisions.
mhm,
Whereas before, I was so tired all the time of thinking
mhm,
about food that I always made the easy, bad decision.
right.
So I always say it just kind of quiets
Mm,
in a non schizophrenic world, it quiets the voices down. Make that clear. Like food chatter, just the
Ah,
obsession with food. And it
yeah,
really is. I had a patient tell me one time, she's like, it feels like somebody finally took my handcuffs off.
I love
mm.
that.
And
And,
so
you
Do you
know
maybe
ever
go ahead, Jason, sorry.
do you ever, have a conversation or experience people that who do have a lot of joy in eating, and then that goes away, and they feel like there's a void or that they don't have that enjoyment anymore, and they feel, like, depressed or down about that, or, like, they don't
I
know how to
it,
replace that?
I feel like maybe 1 or 2 patients in the last probably 3 or 4 years have experienced that.
Mm,
It's a matter at that point, if that's my patient, that we need to kind of titrate the medication to a point where they get control and it helps their insulin resistance and helps their weight loss, but they're still able to maintain enjoyment. And so it is
mhm,
very much a balancing action. That's one thing that I really pride myself with my practice is individual plans, like individuality. There is not one size that fits all. And so it's a matter of coming in and us having conversation and saying, well, let's try something a little different. Let's try maybe a little microdosing, or let's try maybe spacing our shots out a little bit.
mhm,
Maybe we do some supplementation like some inositol or ALA or something like that to help with the weight loss and maybe not use as much medication. Um, I think a lot of people have very unhealthy relationships with food. Um, and I think that kind of comes from just our generation of like the 80s and 90s of like clean your plate and fast eating, like very quick, like TV dinners type situation. And so it's kind of a balancing act of, oh, still respecting that enjoyment of food, but not to the point where it's like detrimental. I haven't had
Yeah.
anybody, like, honestly, I have not had anybody that I can recall that experienced like depressive symptoms.
Yeah.
Um, I would say the majority, vast majority, if not all my patients find they sleep better, they feel better, they have more control, they um, have more energy, um, they're more active, they make better decisions overall. Um, yeah, I can't think of really anyone that has had any kind of depressive episodes.
Okay. Yeah, I feel like that would be
It's a
a
concern though,
symptom of a larger
absolutely.
problem.
Mhm, mhm.
Um, and I think most people probably are excited that all that food noise is gone. So
Mhm. Yeah.
I had
It's
one more
still
question.
yeah.
You mentioned alcohol cessation.
Mm.
I have heard that as well as like an
Mhm.
label use. Have you heard anything? I think it was my doctor at one point had said that they're even looking into treatment for like process addictions like gambling.
Mhm. Yeah.
Um, is that,
Yep.
yeah.
I found a huge help with my patients with ADD or ADHD because they're not dopamine mining anymore. They don't get that massive like hit of dopamine, so it makes it easier to not succumb to those impulsive desires. Um, but yeah, I think anytime you have a vice or an addiction or obsession, it all has to do with that reward system in the brain. In the hypothalamus, you've got certain cells that POMC cells that basically, if you desire something and you're like, I'm going to feel so good when I get this, and then you get it and you do feel good, your brain's like, yeah, let's do that next time. That's
Mhm,
fantastic.
mhm.
Um, and that can be with shopping, it can be with social media, it can be with sex, it can be with eating, sweets. I mean, it can be with working out. Honestly, it can really be anything that has kind of become this
Self-soother.
unhealthy
Yeah.
self-soothing. Yeah,
Mhm.
absolutely. My husband has wild ADD, just wild. And he is kind of the epitome of a dopamine miner, very much. I know Heather and I have talked about this. She's aware. And I feel like the GLP has greatly helped him with that. I think it's given him
Spectacular.
more control back in controlling his desires and succumbing to those. So yeah, I think it can be really, really helpful. And not for everybody. It's not a guarantee, but I think more often than not, I've seen patients come away from their vices more to where it's more of a healthy relationship with whatever they're having an issue with, as opposed to something that's detrimental.
Mhm. And that's
Mhm.
something
I'll
I work
speak.
with. Oh, go
Go
ahead.
ahead, Beth.
Heather, please. No.
I'm just gonna say I'll speak a little bit on my experience and like kind of just a couple of points on what I also notice in my clients, right? That
Mhm.
I personally had to work on going through that process, but also I have quite a few just because of the demographic that I work with, clients who are on the GLP journey or have been. And so for me, a lot of the things that you said, Alex, really resonate. Like it was the way I grew up. I mean, I remember at 5 years old, I was the wrong size. Like, so,
Mhm.
and I'm 52 now. So, like, and I started losing weight 2 years ago.
Mhm.
So,
Mhm.
45 years
Yeah.
of you're not the right size,
Mhm.
right? That just really does something to you. And
Absolutely.
I'm like, well, I'm a size 12. So technically, I am the right size because that's like the average size woman, right?
Mhm.
No, like that's just not how your brain works. And in my family, everything revolved around food.
Mhm.
Literally everything. Where are we going to eat before we go to the thing? Who's bringing what to eat while we're at the
Mhm.
thing? What are we going to eat after we do the thing? Like we
Mhm.
nothing was done that didn't involve food. So
Mhm.
so that just becomes the norm, right? So I do think I resonate really strongly with the idea of the GLP. One of the very first things it did was quiet the food chatter because I quite literally was not hungry.
Yeah.
Yeah.
And the practitioner that I got mine through originally, um, they would have me track what I was eating, right? Because it was a full weight loss
Mhm.
program. They would have me track what I was eating, and I was like, I'm eating, I'm doing good. I'm right in that 12 to 1400 calorie deficit, whatever. And he goes, "You're not eating." I said, yes, I am. He goes, oh, no, read me this, what you ate today. And I was like, Greek yogurt, protein shake, soup. But he goes, uh-huh, you're not chewing any food at all. I was like, oh, damn, because I honestly, that's how ignorant I was. That's how desperate I was, because I'm 5'1" ish
Mhm.
and 5'2" in my big girl shoes. And I was like 205. Like that
Yeah.
is as wide as you are tall, literally. And so I was desperate. So I was like, I don't even care. Just if someone will give these to me, I will take them.
Yeah.
And so I didn't even really do any research. And it was 2 years ago, over 2 years ago, when I started them. And he goes, yeah, don't you know that that's what it works on, is the chemical in your brain that begins to be produced when you chew. And he goes, so that's how, he was like, you're not hungry at all. So to force food, to force calories into your body, you're drinking everything. And I was like, oh, wow. So that was interesting. So that was my experience as far as like that initial thing that it did, is I just wasn't hungry and I just wasn't thinking about food, which everything had revolved around. I talk a lot about that with my clients, of like this idea of, what do I think about if I'm not obsessing about food? And
Yeah.
what will happen is then we begin to replace that with another negative overthinking. Am I doing it right? Am I not doing it right? Am I, this kind of thing. So work with a lot on that. The other thing I noticed in myself, and I hear a lot that you might speak to, is body dysmorphia, right? Because like I had lost like 30 pounds, and on a 5'2" woman, that's a lot of weight to lose.
Yeah.
And I still had quite a bit to lose, but I would go shopping because I was in that phase of, I was like, well, nothing fits. I got to buy a few things that will fit me. And I go to the old size,
Mhm.
and I get things in the dressing room and go, holy, wait a minute. Or I
Yeah.
go and be like, okay, maybe I can wear an 8. Maybe I can wear a 6. I don't know. And it was in that mid range that was the toughest. Maybe I can wear an 8. No way I can wear an 8. I haven't worn single digit pants in 10 years, 20 years. And I'd get in and I'd be like, oh my gosh, or they'd be big. And that, I hear that all the time, because we as women, not to single you out, Jason, because I think guys are too, it just in a different way, but we're so critical, right? Just that negative critic, that inner voice. Like it's almost like we have some sort of glasses on. We literally can't see what we look like in the mirror, and we need affirmation from outside. So that's been a couple of things I've really noticed, like with people on the GLP journey, and my own experience with it is kind of that thing that therapy helps with, is like that reframing, right? Of like, here's who I am now, here's what I do now, this is okay, right? It's almost like they need somebody to work through it with them, like, this is all okay. So,
So, so
have you had an experience with your clients too?
Yeah, a lot of it is just being a cheerleader and ensuring them that they're on the right path, that they're doing well. A lot of my clients, I think a lot of people in general, they compare themselves. They may have a couple friends that are on the medication and they're like, well, they're losing like 4 pounds in a week. And I'm like, that's a little bit too much. So there's a healthy way to do it. And so I think when we try and remove the comparison, because we all know that's the thief of joy, and just kind of reframing it and being a cheerleader, eventually the light bulb goes on. Eventually they see it. I was actually telling a patient earlier, I was like, it's a weird place when you start to see what other people see. For me personally, it was a picture that was taken, and I looked at it and I was like, "That's not me." They're like, "Literally just took a picture of you, Alex." And I'm like, "No." And then I started seeing that in the mirror, and it was but very much like you, Heather. Like you go to the store and you're like, I would gather like 4 different sizes because I had no idea. I had no idea. I haven't been this size since I was a high schooler.
wow.
Like it's insane to me. But like the trying on of clothes, ordering of clothes, how I wear my clothes, it's all been it has definitely been a journey. So I think walking with my patients on that journey is really important, and ensuring, reinforcing that they're doing a good job and that they're on the right path. And, we shouldn't compare ourselves to others.
shouldn't compare ourselves. And it's so, and Heather, to what both of you are saying, the how we women are so critical on ourselves and we need this outside reassurance. And then the outside reassurance is this. This is a big brushstroke and big generalization, but the outside reassurance is just rooted in the diet culture. And women do get, we get lobbed a lot of standards at us and we accept them. And it's an exchange. I get it. And there's a lot that's changing in our culture too. But we're definitely a diet rich culture and
Yep.
we're definitely harder on women than men. And women are harder on women than men.
Yeah,
And
we are.
and there's a lot of that. I want to ask one question, probably. So you're saying that when the medication is no longer being consumed by the patient, that food chatter doesn't come back?
Some patients it does, some it doesn't. Some are able to manage it, some are not. And I think that kind of goes back to like just the biological basis in
Sure.
someone's
Yeah.
body. Someone
Mhm.
might make more hormones that control hunger, that control desire, satiation, reward. Some people are more prone to addictions or obsessions. Um, and so it's really just kind of a journey is seeing, I have some patients that just now do their shot once a month. I do my shot probably every 2 to 3 weeks when I start to hear that chatter kind of come back because I want to try and manage it on my own.
Mhm.
And I think the longest I've gone is 4 weeks and it's like, it rages inside my mind. And so I don't think I'm one that I'll probably ever not do it unless I have to not do it.
Gee.
Um, but it is such a and Heather, I think you can probably speak to this. It's such a relief to not have it that it's kind of almost a little scary thinking that it would come back. So for me, I kind of just tread water lightly.
Are there
And if
are
I
there
don't need it, wouldn't take it.
uh,
But it just depends on the patient. Every patient's different.
right.
Um,
Are
I
there
have
things
I have I have quite a few patients that will do the shot for a while and get to their target weight, and then they'll get off the shot, and maybe they come back to me in, like, a year, like a tune-up. Um, they've been able to maintain that long for the most part, so
Mhm. Are there any versions that are out in the market now? Because like you said, the pharmaceutical companies and all the things they jump in and the medical world kind of jumps in and is like, oh, we are a diet culture country. And so diets sell, they're big money. So are there any on the market now that you would say beware of these imposters or anything like that? Or is that not, has that not been
do
a problem?
you do you mean, like, as far as, like, any diet or any
With
medication or specifically with regards to GLPs?
GLPs, I saw something that said that when it says compounded, that
Mhm.
is not FDA approved. Is
So
that
it's not FDA approved. I don't know if you wanna leave this in the podcast, but I'm gonna go off
okay?
on my
Go ahead,
soapbox.
please.
I don't really trust the FDA, to be
I,
honest.
here,
I think
here.
there are good, solid researchers behind it, but, like, I mean, we've seen Vioxx, Darvon, OxyContin, we've seen a lot of things. They're like, "Oh, no, it's safe.
Yeah,
It's
because it's
fine."
FDA
There's
approved.
yeah,
Right,
and it's FDA approved, so everyone's like, "Oh, it must be
right,
great," and then they
right.
come back and they're like, "Nah, just kidding.
I
It's
I
heroin,"
love that you're
or,
saying that.
like, it's
I
gonna get
agree with you.
like, it's to me, like, you part of going through the educational process is being taught how to critically read research studies. Just because it's a research study does not mean it's a good one. It does not mean it's reliable. It does not mean that we got any information from it that is helpful. For example, the gentleman who said that vaccines cause autism, he lost his license. Like he lied. Like
Mhm,
that that is not a study. Like it
mhm,
doesn't exist, right?
right.
So like we just have to be very cautious. And I think honestly, the COVID epidemic, I think, has opened a lot of people's eyes to just being very cautious and to
Right,
question everything. Like even in medicine, as a nurse practitioner going through that, you know, I I, I started to question everyone and everything. What are the
smart.
motives? If there's big money behind it, I trust it a little bit less.
Mhm. Mhm.
when you put out your research study and over half of it is redacted, why are you redacting it? What are you hiding there? So not to be a conspiracy theorist, but I think it's beneficial to question everything. Um, I use compounding pharmacies. I use very reputable 503A and B cleared pharmacies. So they have sterile processing and testing, and they do third party testing. So I use pharmacies that I would send my family to, and
Yeah.
I do on a lot of occasions. Um, there is this kind of gray area on the market now where there's compounds and peptides is a big one where it's called the gray market. And it's, the bottles are labeled for research purposes and they say it's sterile, but you're like not really sure and not really sure where it's coming from. So, you do have to be very cautious about where things come from.
I agree.
But compounding pharmacies can be very, very helpful. There's a lot of compounding pharmacies that will actually compound like oncology medications. They
Mhm.
cost $10,000 a month, but they can compound it for several hundred or 1,000. Compounding hormones, things of that nature. So yes, it's not FDA cleared, it's not FDA approved. Um,
But the
but
FDA itself begs
neither are
question.
supplements,
Yeah.
neither are vitamins, and people, swear by like it's kind of a gray area, to be
I
honest.
I agree with you, and I'm glad that you said that. And
Yeah.
I agree. I think that there's,
And she
again,
will
going
leave
back.
it in the podcast, by the way.
Perfect.
I I will
Um,
leave it in the podcast.
All
I
of my
want
friends be like, "Oh, that's Alex." Yeah, no.
yeah, we know her. We
I
know
have
her.
no
I want
I
problem.
heard
to
this
ask a
conversation.
couple of questions.
My wife will love that part.
Oh, there
Perfect.
you go.
I
There you go.
agree.
I want to ask a couple questions to touch in on like kind of what Jason had said. Do you what would you say your percentage is male to female who take the GLP journey? And do you notice any differences between how your male clients respond or their success with it versus the female? Is there any difference in that at all?
I would say right now my split is probably 70% female, 30% male. I have several couples that come together, which is really fun. Um, my guys, if their hormones are optimized and their thyroid's optimized, they're going to lose weight as long as they're doing the right things. So like if they're weight training, if they're eating relatively healthy, listen, no one's perfect. If you want to have a cookie, have a cookie. But like if you're eating your protein that you're supposed to get and weight training and really, really limiting or abstaining from alcohol intake, men will lose weight faster. They do have to be more careful because they will lose muscle mass faster.
Mhm.
So they have to be much more diligent about getting enough protein and weight training. Um, but I do think my females, generally speaking, tend to be very, very in tune with their bodies. And so I hear a lot more of like, man, it feels so much better. Like my guys feel better, but the women tend to be much more vocal about the
Mhm.
other aspects of their health that are improving,
Mhm.
not just the weight.
Mhm.
But
So
my,
Do
we
my
you
oh, go ahead, Jason.
do you utilize any? I've heard of the peptide. It's the MOTS-C
hmm
compound. My doctor, he had mentioned it, talking about like it's pending FDA approval, but
Mhm.
he he had read that it was beneficial for people that were on a GLP-1 that were having a hard time eating enough protein to maintain their muscle mass.
hmm
Do you use anything to supplement that?
I
Um,
I do. A lot of what I do in the clinic is coaching. It's like when people come in for their shots, we chit chat. We have like 15-minute conversation. And so just kind of like really reinforcing all these things like their protein goal, their water goal, abstaining from alcohol, weight training. Those are kind of the major ones. Um, I love peptides. They are not FDA approved either. But they can be very helpful in certain situations. They're not great for everybody. Like if somebody comes in and they're like, "Well, I want to build muscle." They're like, "I want to be on CJC 1295 ipamorelin, which is a human growth hormone analog." It's great, but if you're not working out, it's not just going to create muscle. Do you know what I mean? So like if someone's not working out, I'm not going to put them on that
Yeah.
because they're just putting something in their body that's not going to do anything. Like, it may help with some fat loss, but they're not going to build muscle. You have to physically do that. Um, the 5-amino 1-MQ is really good. It actually helps with energy levels on a mitochondrial level. So there's several. I love BPC 157. I think it's fantastic.
I've heard good things about it.
It's amazing. I use that orally, also not FDA approved. I use that orally. I use it for acute injuries, injectable around the site. Some practitioners feel like it's not necessary to inject subcutaneously around the site of injury. Some believe you can just do it like in your tummy fat or your flank or something like that. I've had really great results with my patients with acute injuries, injecting it just subcutaneously around that joint. So if somebody like tweaks their knee, they'll do 2 or 3 injections around the knee once a day. I've used it post-surgically in patients as well. So yeah, I love BPC like a lot. Um, let's see, NAD, not technically a peptide, it's a coenzyme, but NAD is amazing. And it kind of goes back to the whole the Krebs cycle, which I don't know if anyone has PTSD from microbiology or biology in general, but it's how our body creates energy. And so you need water, you need NMN, you need NAD, you need some other things. It's a ridiculous like cycle. It's super, super, super intricate. But NAD has been fantastic as well. I take it. I feel mentally clearer and faster. I feel like my skin has gotten better. I don't get like the mid-afternoon slump anymore. So there's lots of kind of
I want
adjuncts to GLP that can be helpful if needed.
to. I want to ask, I want to kind of shine a light on other things that you do offer. I know that the GLPs are kind of the star of the show currently in our American culture, but I want to shine a light on because you offer so many more things at Fort
Mhm,
Wellness, and you have the IV infusions, the
mhm,
peptides to which you were talking, Jason. And vitamin injections. I have a
mhm,
question before I do want to hear all about these things. Do you see something like, is there a one vitamin, if you will, that you find your patients more deprived of? Is there a vitamin that we're simply not feeding ourselves as a culture, or
Honestly, like
or is that
vitamin
not
D,
a thing?
people are really low in vitamin D, and
It's the
vitamin D
hardest
is
thing to get in
fantastic.
food. It's the
I
hardest
know.
thing to get in
Mhm.
food, vitamin D.
Yeah.
There's limited
Um,
amounts of food
it's
consumption for that.
It is. I am injections of vitamin D, so it's 50,000 units, which in medicine, I was prescribing a 50,000 unit capsule. So you can do it orally as well. But I do think the injection is, and it doesn't sting or anything, it's just oil based, is fantastic. Um, it is fat soluble. So it is one of those that you don't want to be doing it like every single week and not test your vitamin D because, we can go over the limit. I've had a couple patients in family medicine years ago that were taking a lot of over the counter vitamin D, like a lot. And the upper limit on the lab is usually 100, and they were like 120. Now, they didn't feel bad, like nothing happened to them, but, more is not always better. So I kind of
Right,
like to
right.
keep it like an optimal mid-range. Vitamin D is a big one. B12 is always good, but B12 is easy to get. As long as you're not a vegan or a vegetarian, you usually get that in your diet. Also, it's always thrown into supplements. So a lot of times people do have to actually be careful. Like if they're doing like a Celsius a day and then a multivitamin and then a B complex, like you're getting like way too much B at that point.
Mhm,
And your body just has to process it. So you're just going to pee it out. But it's
mhm.
still something that your body has to try and get rid of.
Tell
Um,
us.
I love glutathione. I do a shot weekly called Triimmune. It's a
Mhm.
combination of glutathione, which is a really great cellular detoxifier, vitamin C, and zinc. I don't know, I just feel better on it. It's really interesting. Um, got a B complex. So the B complex is interesting. It's 1, 2, 3, 5, and 6 as far as the Bs. A lot of people use it for stress relief, but what I find is when someone's very stressed out or anxious, they tend to find that they get energy from the shot because it's kind of calming everything down. So they have more energy to kind of
Yeah,
focus on other
it's
things.
reserved. Yeah,
So I always like the combo of the B12 and the B complex.
I love
Yeah.
this. And tell
Yeah.
us in the next couple of minutes, tell us before we wrap up, tell us about the other, you talked about, because of my question, you talked about some specific vitamins. Talk to us about the IV infusions and
Yeah.
the things that you also offer in addition to the GLPs.
Mhm. So IV infusions are great. Most people are chronically dehydrated. If you can drink water and get enough of it, that is going to be by far the best for your body. Oral hydration, even in the hospital, in the emergency room, pediatrics, it's always the first step is oral hydration. But if for some reason someone has imbibed a bit too much the night before, or maybe they have a stomach bug and they're just vomiting, it's a really great way to replenish the hydration and replenish any vitamins or nutrients. Even though I have my Stanley and I've been sipping on it, I'm a horrible water drinker. So I love IVs. Um, I know. Goodness sakes. Sorry. And it's
No
easy.
problem.
It's like 20 to 30 minutes. I can go to someone's house and do it. I've gone to TV sets. I do it here in the office. So it's easily, I have a little portable IV pull. So it makes it really, really easy. Why are you whining?
Not enough attention.
It's very vocal today. I
So
apologize.
how do our listeners find you, and what can they, you mentioned going
Yeah.
to a house, but also coming to the office. How do people find
Yeah.
you?
Absolutely. So you can on my social media. I just got a new social media manager. So I'm very excited to start with her. Her name's Sunny. So she's gonna do all the fun stuff that this Gen Xer doesn't want to do. Which
Totally
is
hear you on
crazy.
that.
I love it so much. Like, just tell me what to do. I'll say whatever. Um, so social media, Instagram and Facebook. We don't have a TikTok yet, but she says we're going to start one. So
Mm.
look out for that one. Um, Website is fort-wellness.com. And then you can just text me, honestly. I'm happy to give my cell phone out. You can just text me directly. That's honestly probably the easiest way. It's just 817-999-1175. I have it on me at all times. So yeah,
Is
those are
that
the best ways.
is that the number on your website?
Yeah.
Okay, excellent.
Or you can come to Vervewell and see one of
Yes.
the fabulous Vervewell therapists and scan her
Yes.
QR code, which will be in our offices next week.
I love that.
Excellent.
I'm
I love
excited.
that,
Gonna
Heather.
lulls.
And Alex, you're doing a really awesome thing for our Vervewell clients too, is giving priority scheduling. So if
Yeah.
anybody does reach out to you, if they will let you
Yes.
know that they're a Vervewell client,
Oh yeah.
you'll kind of sneak them in as quickly as you
Oh
can.
yeah.
So you can as big of a
Yeah, I
waiting
want to
list
be
across them.
flexible and really help people get in because I know when you make the decision to kind of improve your health, like you want to do it then.
Mhm.
Sometimes we are a little impatient. Like this,
Well,
That's a perfect ending.
on that note,
um,
Alex, thank you
silver,
so much for
silver
your
tit guy.
Alex, thank you so much for your time on this Friday evening. And we really value you as one of our
Yeah.
partners. And I love what you're offering your patients and our clients. Vervewell.org for all things Vervewell, as well as connecting to Fort Wellness. Their beautiful logo is right at the bottom of our homepage. And you can click on that and go right to all the websites and the social media that she just mentioned. Thank you so much, Heather. Thank you for your personal experience and your knowledge. And Jason, thank you so much for being here. And so, yeah, y'all enjoy the rest of your evening.